tympanic membrane's perforation can also be seen during otoscopic examination. So now we discuss the tympanic membrane perforations in detail. The perforations are classified based on location where the perforation is located. For the descriptive purpose, we can divide the tympanic membrane into 4 halves. The 4 half is the anterior superior, anterior inferior, posterior superior and posterior inferior. So these are imaginary 4 quadrants of the tympanic membrane. So we will notice if we come across a tympanic membrane perforation like this, we will notice the site of the perforation, in which quadrant the perforation is present, the size of the perforation, of which size the perforation is, and we will also see the margins of the perforation. The margins, whether those margins are healed or not, and we will also peep into the middle ear through this perforation. We will see the middle ear mucosa through the perforation. If perforation is that big, we will see the condition of the middle ear mucosa. We can see the middle ear ossicles through this perforation. We can see the mucosa of this middle ear, whether this is red or velvety, and we can also appreciate the discharge in middle ear cavity. So we will see and we will notice the margins of the perforation, whether the margins are fresh margins will denote that this perforation is traumatic and may be traumatic, and this is a new perforation and this can be healed early. But the margins can be healed, and healed margins are difficult. It would be difficult for the perforation to be healed if the margins are healed. So the perforations are described as central and marginal perforations also. Central perforation, it's not necessary for a central perforation that it would present in the center, but all around the perforation, the remnant of tympanic membrane would be there. Here you see the remnant of tympanic membrane is there. So it would be labeled as central perforation. However, this perforation is not present in the center of the tympanic membrane, but the central perforation will be labeled when it would be margined by, it would be lined by the remnant of tympanic membrane. In cases of the marginal perforations, if suppose this is a perforation, this is the margin of the tympanic membrane or the annulus, and suppose on this side there are the remnant of the tympanic membrane, but if there is no remnant here, because here would be the bone, so this perforation that is not lined all around by the remnant of tympanic membrane would be labeled as a marginal perforation. So these are the 2 big types of perforation. Central perforation, these perforations are present in the pars tensa mainly, and the main part of the eardrum. They are often associated with ear infection like in chronic suppurative otitis media, and they typically maintain a portion of the tympanic membrane surrounding the hole. As I told you that the marginal perforations are the perforations which involve the annulus, This is annulus, the ring-like structure surrounding the eardrum. So this hole is the annulus, which is a ring-like bony structure that surrounds the eardrum. These perforations, the marginal perforations, are not surrounded by the remnant of the tympanic membrane. They are more likely to be associated with cholesteatoma and atticoantral disease, and this may be very harder to repair. The marginal perforation will also tell us that the patient is having unsafe type of otitis media, that is the atticoantral type of otitis media, and there can be a cholesteatoma behind a marginal perforation. So in serious cases or in unsafe otitis media, marginal perforations will be there, but in tubotympanic disease or in safe type of otitis media, there will be remnant of eardrum, and there will be discharge that would be profuse and mucoid, and this will tell us about the nature of chronic suppurative otitis media, and the disease would be tubotympanic in cases of central perforation. Now we can also come across a total perforation. In total perforation, there will be this type involves a very large tear in the eardrum and leaving minimal membrane. Only little part of the membrane is left, and in cases of total perforation. And there can also be a subtotal perforation, total and subtotal perforations. So we will, after seeing the site of the perforation, in which quadrant the perforation is present, we will notice the size of the perforation. The perforation can be of small, medium, large size. A small size perforation often less than 10 millimeter in diameter, and the medium size perforation would be between 10 and 30 millimeter, whereas the large perforation will be more than 30 millimeter in diameter. Okay, so these are the sizes of perforation. A small perforation less than 10 millimeter, medium perforation between 10 and 30 millimeter, large perforation larger than 30 millimeter. Classification: acute perforation can develop suddenly, often due to trauma or an ear infection, and the chronic perforation has been present for more than 3 months. Other considerations: we will see whether the perforation is traumatic, and the traumatic perforation can result from a blunt or penetrating trauma to the ear canal or from rapid pressure changes. Now we will notice the shape of perforation. The shape of perforation can be triangular perforation, it can be oval perforation, irregularly shaped perforation. The perforation can be of kidney shape, and the perforation can also be of heart shape. It can be a shape of a tear. So these are different shapes of the perforation. So the shapes can be triangular, sector, kidney shaped, ovoid perforation, or irregular perforation. It can also be of heart shape. It can also be a drop of water shape and other shapes as well. So we notice whether the tympanic membrane is retracted or not. The tympanic membrane may be pulled medially or retracted from its normal position. Suppose this is a normal position of the tympanic membrane. If it is retracted medially, then there can be absence of the cone of light as well. So the tympanic membrane may be pulled medially or retracted from its normal position. Tympanic membrane retraction is a condition in which part of tympanic membrane is retracted into middle ear cavity, and it is also known as retraction pocket, and it is frequently seen in children. The prevalence of tympanic membrane retraction in children is reported to be 8% to 10%, and mostly it's being mild cases in the pars tensa. Negative middle ear pressure, we can notice the negative middle ear pressure, which is caused mainly by the dysfunction of the Eustachian tube or by inflammation, and this negative pressure is considered a main causal factor in the cause of tympanic membrane retraction. Tympanic membrane retractions are mostly localized in the posterior superior part. The tympanic membrane retraction is seen in the posterior superior part and in the of the posterior superior part of the pars tensa. It is mainly seen in the children. It is circular fibrous layer. Furthermore, the retraction pocket is well vascularized and therefore more vulnerable to infiltration of inflammatory cells and mediators. During inflammation, these cells secrete collagenase and elastases that result in damage of collagen fibers. We can also come across ear wax, and it can obstruct the view of tympanic membrane. So our findings, these are the margins of a fresh perforation. You see the margin, the color of margin is pinkish red. The shape is irregular, and this perforation is present in the anterior inferior quadrant of the tympanic membrane. So we will notice the site of the perforation, size of the perforation, shape of the perforation, margins of the perforation, and status of the middle ear through the perforation. Okay, so here we conclude the perforations.